ulcers, also known as mouth ulcers or canker sores, are a common clinical manifestation encountered in otorhinolaryngology. These painful lesions can significantly impact a patient's quality of life, making it crucial for medical professionals to have a comprehensive understanding of their etiology, clinical presentation, and management. In this script, we will delve into the depth of knowledge regarding all aspects of oral ulcers, ranging from their underlying causes to advanced treatment approaches. By the end of this script, you will be equipped with the necessary information to diagnose, classify, and effectively manage oral ulcers in patients. Oral ulcers can result from trauma, viral infections, such as HSV and VZV, autoimmune diseases, for example, mucous membrane pemphigoid and pemphigus vulgaris, and nutritional deficiencies. Recognizing the various causes is essential for accurate diagnosis and appropriate management. In this section, we will cover the clinical presentation and classification of oral ulcers. Oral ulcers can vary in appearance, location, size, and associated symptoms. They may appear as shallow or deep lesions with a yellowish-gray pseudomembrane and erythematous halo. They can occur anywhere in the mouth, such as the mucosa, tongue, lips, and gums. Based on their size, ulcers can be classified as minor, major, or herpetiform ulcers. Minor ulcers are small and heal within 7 to 14 days, while major ulcers are larger and may take longer to resolve. Herpetiform ulcers are multiple, clustered, and small, despite not being related to herpes. Common symptoms include pain, burning sensation, and difficulty eating and speaking. Understanding the clinical aspects of oral ulcers is crucial for accurate diagnosis and management. Oral ulcers can resemble other oral mucosal lesions, including herpetic lesions, lichen planus, pemphigus vulgaris, and erythema multiforme. Recognizing these differences is important for effective treatment and avoiding complications. Histopathological examination of oral ulcer biopsies plays a crucial role in establishing a definitive diagnosis. Microscopically, oral ulcers typically exhibit loss of the superficial epithelium, which is accompanied by an underlying inflammatory infiltrate. Inflammatory cells, including neutrophils and lymphocytes, infiltrate the submucosal connective tissue. The healing patterns associated with oral ulcers involve re-epithelialization, granulation tissue formation, and eventually, scar formation in chronic cases. Analyzing the histopathological features aids in confirming the diagnosis of oral ulcers, especially in challenging cases that may mimic other mucosal disorders. Recurrent aphthous stomatitis, RAS, is a common condition characterized by oral ulcers. There are 3 subtypes: minor, major, and herpetiform ulcers. Genetics and immune factors play a role in RAS. Management involves symptomatic relief and prevention of recurrences using topical corticosteroids, antimicrobial mouth rinses, and systemic medications. Oral ulcers can be linked to conditions like Behçet's disease, Crohn's disease, and HIV infection. Recognizing these connections improves patient care. Behçet's disease is a vasculitis that causes recurrent oral ulcers, along with genital ulcers, eye inflammation, and skin lesions. Crohn's disease, an inflammatory bowel disease, often presents with deep, linear ulcers and cobblestoning of the oral mucosa. HIV infection can also cause oral ulcers, usually due to oral candidiasis or herpes virus infections. Identifying the underlying condition aids in diagnosing and treating oral ulcers, as a holistic approach is necessary considering the systemic disease. Untreated or poorly managed oral ulcers can lead to complications. Bacterial superinfection, scarring, and impaired oral intake are potential complications. Early and appropriate management is crucial to minimize these risks. Diagnosing oral ulcers involves a systematic approach that combines clinical evaluation and, in some cases, laboratory investigations. A thorough history taking and physical examination, including examination of the oral cavity, are essential for diagnosing oral ulcers and identifying potential underlying causes. Laboratory tests, such as complete blood count, iron studies, and serological tests, may be ordered to evaluate for nutritional deficiencies, autoimmune diseases, or systemic infections. In certain cases, a biopsy of the oral ulcer may be necessary to establish a definitive diagnosis. Accurate diagnosis ensures appropriate management, minimizing the risk of undertreatment or overtreatment. The treatment of oral ulcers involves the use of topical corticosteroids, analgesics, antimicrobial rinses, and immunomodulatory agents. These medications help relieve pain, reduce inflammation, prevent infections, and promote healing, depending on the severity and cause of the ulcers. Adjunctive therapies like laser therapy, oral hygiene measures, and dietary modifications can assist in treating oral ulcers. They have been proven effective in promoting healing, relieving pain, maintaining oral health, and enhancing patient comfort. These therapies should be used alongside medication for a comprehensive approach to oral ulcer management. The education of patients is crucial for effective management and prevention of oral ulcers. Teaching them about triggers, self-management, and prevention methods empowers them to take control of their oral health and decrease recurrence rates. The field of oral ulcer management is continuously evolving, driven by ongoing research and clinical trials. Staying up to date with recent advances enables healthcare professionals to provide the most current and evidence-based care to patients. Emerging therapies, such as novel immune-modulating agents or growth factor therapies, hold promise for improved outcomes in the management of oral ulcers. Targeted interventions aiming at specific underlying causes, such as treating iron deficiencies or managing autoimmune diseases, are being explored and may revolutionize the management approach. Continuous professional development ensures proficiency in incorporating new knowledge and advancing patient care. In conclusion, oral ulcers are important for doctors to understand. They have different causes, presentations, and treatments. By staying informed and improving clinical skills, we can give better care to patients with this condition.